The cervical screening has just changed. So it used to be that we did cervical screening every 2 years, but it's now changing to every 5 years. The thing is though that you need one negative screen in the new screening program before you go to 5 years. So we're testing for something different. We're testing for HPV virus rather than looking for abnormal cells.
Human papillomavirus causes 99% of cervical cancers, and so by detecting it in the screening test, you pick it up quite early, ways before someone's got a cancer, and then there needs to be further tests to see whether the HPV is actually causing a lesion in the cervix, so that's why you need to have a reflex cytology and maybe a colposcopy, which is a further investigation. But that way they anticipate that they'll be able to pick up cancers earlier.
And if we don't find HPV virus and they don't have any other risk factors, then it goes to 5 years, which I think a lot of women are going to love. One of the things that we're all concerned about is that because young women have been immunised for cervical cancer with the HPV vaccine, that they may think they don't need to be screened, which is not true. Even if you have been immunised, you still need to be screened, starting at 25. And then, if everything's okay, then you would have repeat screening every 5 years.
The barriers that are identified are probably cultural, some cultural barriers. That can be people from non-English speaking backgrounds, but it can also be in the Aboriginal and Torres Strait Islander, where there are quite big barriers in terms of secret women's business and probably cultural barriers too from some of our culturally and linguistically diverse groups.
With cervical screening, people get very nervous about what that involves because they have to actually take their clothes off in front of a doctor and they can't even see that area that's being examined. So I think that they get scared it's going to hurt, they get scared that it will be super embarrassing. And so I think explaining exactly what the test involves helps people.
It has been shown over many, many years that if you can find a precursor lesion or you can find something that predisposes you to cancer early on before you've developed the full-blown cancer, basically you can treat that and you never will even develop cancer, or in some of the screening programs you pick up the cancer so early that you actually save the patient's life. So it's one of these lovely areas in medicine where you are actually able to prevent disease occurring, prevent significant disease occurring, and cervical cancer is one of those. And so we, in the old screening program, have literally halved the rates of cervical cancer and then more than halved the rates of death of cervical cancer.